Hello and welcome to Borno Health Update. My name is Ibrahim Amarawa. Health Update, as you are aware, is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the stewardship of Professor Baba Malamgana, the Commissioner of Health and Human Services, Borno State. Maternal mortality is one of the pressing issues that requires strong and urgent intervention to eliminate, especially in Borno State, given how many women lost their lives or infants needlessly during childbirth. As a result, the State Ministry of Health is working tirelessly to develop new health programs aimed at eradicating maternal mortality. The Commissioner of Health, Professor Baba Malamgana, highlighted the severity of the issue in northern Nigeria, particularly in Borno State.
As your viewers may wish to know, that the federal government of Nigeria has, according to data available, figured out that there are 172 local government areas in Nigeria with the highest burden of maternal death or maternal mortality. Unfortunately, Borno State is number 3 in terms of 13 local government areas that are having the highest burden. This stretches from Biu to Bayo to Hawal to Shani to Dambua, and the central zone we have MMC, Kondiga, Jere, Mafa affected, and in the northern part we have Monguno, we have Damasak, and we have 13 of them altogether. But the important thing is to realize that Nigeria is contributing heavily to maternal death in the world. And therefore, unless we wake up and do something about it, our mothers are dying needlessly, and newborns are dying needlessly, and Nigeria contributes about 30% of global death in terms of maternal mortality. And this is we're out to stop in Borno State in particular, and now in Nigeria in general.
The Ministry of Health is not only continuing its previous initiatives to address this issue, but has prepared to launch a new program called the Be Mama program, which is expected to make maternal mortality a thing of the past in Borno State.
As a matter of fact, we had a workshop on maternal mortality reduction here in the International Conference Center in Secretariat in January 2024, and through which came this special program that we are about to launch next week here in Maiduguri. This special program has been done or is running in Tanzania, in East Africa, where they are able to crush maternal mortality by 75%. Yes, 75% reduction in maternal mortality and 50% reduction in neonatal or newborn mortality. This is fantastic results, and you cannot ask for better results. And this has been published now in various journals, including the New England Journal of Medicine. So therefore, it's a program based on research. It's a program based on publication of over 150 papers, and also about over 20 Tanzanians have gotten PhDs in this program. This involves innovation in clinical work, innovations in training, and innovations in quality assessment, quality of care assessment, and data collection. And therefore, it's based on facility training, where the staff who are involved in the labor wards or pediatric wards are trained. They can do the training on their own, and there are mannequins which they use, and this mannequin is now linked digitally to central area, and you can see who is training. And furthermore, there have been inventions of new gadgets like the the fetoscope that we use, which has been 200 years old, is now digitized, and therefore you can easily see on the digital platform whether this is accurate heartbeat for the baby or fetus compared to the mothers. and then you can be able to take action. And most importantly, there is a problem of postpartum hemorrhage, which is, women losing blood after they've had baby, and this is very important, and we are going to tackle this heads-on in this SBBC program by making sure that the prevention is better and cheaper than cure. So we try and prevent the blood loss, but where it happens, then we are fully prepared to use the necessary equipment and necessary medications, and where need be, prepared to offer even cesarean section free of.
Before these Be Mama initiatives, the state government introduced prematernal services across the state. The medical director of the state specialist hospital and other officials explained how this initiative has significantly reduced maternal death during childbirth.
Actually quantify or explain by words. That is what PROP is doing. His Excellency, when he came on board, I think you've heard what happened in Omar Show when he went there late at night. So he does his monitoring by himself. He never allowed anybody to do it. Now that we are not seeing him, it doesn't mean that he's not around. He has so many eyes, so many ears. So the slightest inch of movement that happens, he knows about those ones. So his style is good. That means he is in touch with these people. He's closer to them the way he's doing. We're always on our toes to make sure things work very well. So those of us that enjoy this kind of work, I think we are finding it very easy and accelerating for us to undergo through this type of leadership. And that is why when the Honorable Commissioner came on board, he brought this issue of clinical governance, which is worldwide a cutting-edge program that actually takes care of all the loopholes. So clinical governance has come to stay, courtesy of Honorable Commissioner, with support from the governor. The governor is always supporting all their needs. That's why you see them writing, or any of their requests is being addressed squarely by His Excellency. In fact, at times, he even reminds them that there are things that he needs to do. This coming up with these free services. You've heard about free eye surgeries that took place, which is courtesy of the state government. And in fact, he didn't do that. He also reimbursed, or should I say, incentivized all the patients that had undergone those operations. No, the payment was waived, no, but they also collected some things. Here too, free maternal services. All women that came into state hospital, they enjoy the services. You need to come and see our antenatal clinic day. It's always jam-packed. In fact, we have to do several sessions in order to cater for the people. And the government too is not relenting. Initial procurement of those drugs were judicially utilized, and from there they now made apart from first need assessment. So there was another need assessment. Why was the second need assessment? Because of the influx. It has almost quadrupled. So that now necessitated the government to now increase its procurement of those consumables. I think it's quite impactful.
Thank you. And lastly,
I think we enjoyed more. As you can see throughout the hospital, we have a Starlink. This is it. We can actually link it up. So throughout the hospital, we have this Starlink that has come to stay. And this has greatly impacted on the residency training program that is ongoing. All undergraduate doctors that have already gotten their MBBS that want to further their education in various departments have now started doing so in this particular hospital. So obstetrics and gynecology have their own accreditation by West African College of Surgeons, and re-accreditation was also carried out just last 2 weeks. And from all indications, we've gotten it because of the support. It involves huge amount of resources, financial, infrastructure, and human resource. Everything is part of it. And the government has supported all through the Chief Medical Director, Honorable Commissioner of Health, and then even the governor himself.
It's a very good strategy that was initiated by the state government, because earlier on we were having a lot of challenges. Women will come accompanied by elders, an elderly woman. The husband is not available. If you ask the woman, get something, she will tell you that she only has 50 naira. And 50 naira now, even a child cannot, if you give a child 50 naira, he may not even appreciate that money. But now, when they know that at the facility it's only blood, that we now ask them to go and get their relative, because there's no shop for, you have to bring the blood, is blood bank. So you have to come and donate, you deposit, and then another person gets the blood. So they come, they avail themselves to the hospital, and this one also reduces, this one has also reduced the delay in offering our services, and by so doing, reduction in maternal and perinatal mortality and morbidities.
I've worked with Borno State government for like 10 years now. I would say in my 10 years of service, what happened before I came on board, I wouldn't know. But I would say in my 10 years of service, Professor Babagana Umara Zulum is the first governor that I had a one-on-one town hall meeting with. There was a time he visited this facility and he called all the HODs and had a meeting with us to listen to our problems. If you move around the hospital, you see a new building being erected. That was one of the promises he made in that town hall meeting, and you can see him fulfilling it. Since I came on board, CS, antenatal, everything has been paid for by the family. And sometimes you will see a woman, she would come crying. The staff would have to dip their hands in their pockets sometimes and sort her out. If not, she may not be able to afford delivery. But now it is free maternal services. It's not something cheap. And I will say thank you, Your Excellency. I am a woman. Let me be a bit sentimental. Thank you so much for coming to the aid of the women in Borno State. We are grateful, Your Excellency. Digitization, even the Borno State Drug Management Agency, it came to limelight when the Commissioner, His Excellency, Professor Babagana Malim, came on board. And I can say it has solved a great deal of our out-of-stockage for drugs and consumables in the state. And as you can see, this brand new computer is courtesy His Excellency's Professor Baba Malim's initiative of computerizing the health facilities so that it will help us to serve our patients better. Records will be kept, it will be lost, and I think we are happy and we are grateful.
We thank God for the intervention. The issue of a free maternal service has been impactful. There's no doubt about it. Many of our patients do come. Some come at emergency points without having the financial capability for some of the emergency procedures that may be required. And because of the intervention of the free maternal services, we see that some of them do even undergo some theater procedures without even paying a penny. That saves their life first. Apart from that, it also saves the life of their, some of them become pregnant. So we also make sure that so those timely interventions are not something one can actually monetize. But because of the fact that there's somebody, the government is paying the bills behind the scenes, it makes some of these operations seamless.
Additionally, women who have benefited from this program express immense joy and gratitude to Governor Zulum for this wonderful initiative.
Askarangana shura gulteba ala shakolzi ala farmaina kalar siwal tisidi shura gulteba shura askarangana donna indiro chondi aiso andiro dire choro liulaso dripso Sama niro dere chere awro yu yana mabao. Atima yu yana mabasoro.
Sunana Maryamu Bitrus, ina kulallori da Mbuwa Road. To abin da aka yi ma jama'a mu ma mun dandana mun gode. Ma gwamna Zulum muna ce mishi mun gode. Abin da ana yi da kuɗi mu kyauta muka samu. To muna ce mishi mun gode Allah ya saka da alheri. Gwamna Zulum ya mana CS kyauta. To kaga dole mu ce mishi mun gode Allah ya ɗaukaka shi. Le ba shi abin da yake nema.
Sunana Hauwa Ismail. Gaskiya alhamdulillah da muka zo mun samu kula sosai gaskiya. Kuma gani ma mun samu na kyauta alhamdulillah mun gode Allah ya saka da alkhairi. Mun samu kulawa sosai Allah ya biya.
Sunana Fatima Yahaya. Aikin da aka yi min a asibiti sai dai in ce na gode gaskiya. Dan tiyata na 4 a asibiti 2 ne kawai na biya. Da wannan da na last ɗin duk kyauta. Da magunguna da komai kyauta gaskiya sai dai ba abin da za mu ce dai mu gode. Magunguna su drip syringe komai ka nema kyauta gaskiya. Komai ka nema dai in dai na fannin lafiyanka ne kan kyauta ne za ka je ka karɓa. Gaskiya mun gode.
Sunana Fatima Ali. Asibiti tiyata aka kawo ni. Kuma alhamdulillah kyauta aka yi mu. Na gode sosai da gwamnan na Allah ya saka da alkhairi.
The Health Commissioner, Professor Baba Malam Gana, commended Governor Babagana Umar Zulum for providing all the necessary support to the Ministry of Health to achieve its desired objective.
In Professor Babagana Umar Zulum, His Excellency, the Executive Governor of Borno State, CON-MNI-FNSE, in him we see a person who is very compassionate. In him, in Professor Babagana Umar Zulum, we see a person who is focused on the healthcare of the citizens of Borno State. It's during his tenure that we have seen free drugs for all the pregnant women. It's during his tenure that we've seen free cesarean section to all the women. And in his program, we have seen so many changes in terms of infrastructure, both at primary and secondary level, and now in tertiary level, we are seeing the situation where we're about to commission a teaching hospital and a medical school owned by the state government. And I will urge your viewers to be shown the facilities of this, the teaching hospital. And in Professor Babagana Umar Zulum, we're seeing that for the first time in Borno State, the salaries of the staff of health workforce in Borno State are at par or at the same level with that of the federal government. These are measures to help in recruit and retain staff and making sure that they are comfortable at place of work and making sure that they are kept up to date, so much so that our staff would stay behind to look after the citizens of Borno State. For that, we're immensely grateful to His Excellency, and words are not enough to say thank you to Your Excellency for what you have been doing in the healthcare sector. We have enjoyed above 15% of the budget allocated to healthcare, and we are seeing a lot of hospitals being built, a lot of primary healthcare centers being built, a lot of primary healthcare centers being renovated, revitalized, and all these are down to the executive governor who has got empathy and who is compassionate for healthcare delivery in Borno State.
Well, viewers, with this, we have come to the end of this week's episode of Borno Health Update. We hope you enjoy the program. Join us next week for another interesting segment. Until then, I am Ibrahim Amara saying bye for now.